everyone, I'm Lindsay. Welcome back to my channel all about endometriosis. I wanted to talk about why endometriosis is such a struggle to be diagnosed with. Diagnosis is taking, on average, 8 years to be diagnosed, from symptoms first starting to finally receiving your diagnosis. Personally, my symptoms started when I was 11 years old, and I didn't get diagnosed until I was 31. Now, I'm absolutely shit at maths, but I can tell you that 20 years from symptoms starting to being diagnosed is far too fucking long. With myself, what happened was I started my period at 11. They were really heavy, painful, straight away from the get-go. I went to a doctor who, obviously my mum took me to the doctors and we explained what was going on. I was hemorrhaging every time I had a period, and I would go to bed and then I'd wake up in the morning completely drenched in blood. It would be all over my bed. I'd look like a fucking murder scene. It would even be in my hair. Ridiculous. My doctor had never seen anything like it. He did some research and he got me some medication from Germany. Really cannot remember what it was, but I was put on medication basically straight away. Just to control my periods, but I was told that I was too young basically to have anything particularly wrong. I was told that I would grow out of it. I was told that I was just unlucky with my periods and that I would just have to deal with it until I got a bit older and things would hopefully settle down. Things didn't settle. And as I got older, my periods got worse. I was also in pain frequently throughout the month, not when I was just on my period. What I didn't know at the time was that my insides were beginning to stick together. So I was in a lot of pain, which is compared often with endometriosis compared to the pain of like the final stages of labour, so extremely painful. And I was again going backwards and forwards to the doctors, and I was being told it will change, you're unlucky, some people just have heavy painful periods. And then finally a doctor decided to look into it, and I had an ultrasound, and as with endometriosis normally does, it didn't show up on my ultrasound. So obviously results were clear, and my doctor just told me there's nothing there. It's just you're probably just causing it yourself. Like, by looking at you, I can see you're quite tense. Exact words, by the way. Obviously, if you're in crippling pain and you can't find an explanation for that, you're probably going to be a bit tense or look a bit tense whilst sat trying to get help in a doctor's office and not really, receiving much. So I was told to go away and have a baby. And the words of the doctor were, most women that are unlucky with bad periods find that once they've had a baby, it clears them out. And then all of their problems just stop. I was very young at the time when I was given that advice, and luckily I decided not to take it. Personally, I didn't think that would go down very well on a first date. Hi, what are you looking for in a relationship? A cure and a baby. So I cracked on with life, still going backwards and forwards to the doctors to get medication to make my periods lighter, trying out lots of different contraceptives. I eventually got an appointment to see a gynecologist in hospital, and I was so happy to get that appointment because I thought, this is it, this is my chance to actually be listened to and look into this and find out what's going on. I was really nervous, so I wrote down all of my symptoms in bullet points, went all prepared, and the gynecologist had looked at my ultrasound results and he said to me, there's nothing wrong with you. I handed him my list of symptoms and he didn't want to look at them. He pushed them back to me on the table and he said, I've heard enough. He said to me, your symptoms are not typical of endometriosis. You just need to learn to cope with having period pains. It's just part of being a woman. So off I went, feeling very deflated, very fobbed off, just really not helped at all. And at this point, I was literally collapsing every time something was going on with my endometriosis because I was feeling like I'd been stabbed. What we didn't know was that I had large lesions forming and cysts growing, one that was growing bigger and bigger and bigger, but obviously no one was looking into it. Various organs were sticking together, and I was blacking out, I was throwing up, my body was going into shock, but there's nothing there, so we move. To cut a long story short, because I find that I start to repeat myself with this story because it went on for far too many years, in the end I ended up saving up and paying privately with a private specialist to have an MRI, because I got to a point where I was so deflated and down and confused and anxious and just didn't understand what was going on with my body, like why I was experiencing these fucking horrible crippling pains, and I was just constantly being told that it's just me. I was having counselling, I was having hypnotherapy, trying to just work on my levels of pain. So yeah, I got to the end of my tether, I think we'll put it, and I went for my MRI with my specialist. Cost me a fucking arm and a leg, but there it was, clear as day. Stage 4 endometriosis. My bowels and my ovaries and my womb were all stuck together. I had a large endometrioma cyst which had grown, it was about 7 or 8 centimetres all the way round, so like tennis ball size ish. I had more endometriomas in my, like on both sides, and lesions and cysts. I was diagnosed with something called rectovaginal, lovely, endometriosis, where everything was just attached. And I had endometriosis in a place that I'd never heard of before, actually, within my body, something called the pouch of Douglas. Of course, part of the woman reproductive system is named after a man. I mean, why wouldn't it be? But yeah, I also had endometriosis in my pouch of Douglas. So pretty much everywhere throughout my pelvis. And I finally had answers as to why I was in so much pain. And I couldn't help but think that if that first gynecologist that I'd gone to see had just looked into it a bit further, without fobbing me off, I may not have reached that situation of being diagnosed with stage 4 endometriosis and having to have extensive surgery, being in there for hours, just trying to separate my organs and clear things up a bit. In the process of all of that, I had things happening like cysts bursting inside me. I went to A&E before I received my diagnosis with a burst cyst, and I was seen by a male gynecologist in A&E who told me that he doesn't believe that my symptoms are endometriosis. He put me on a list to have my appendix removed. So I was in hospital overnight. They finally had a look with a scan, told me that after all it wasn't my appendix and that I had a cyst which had burst, and not to worry about it because it would just go away, go back into my system and I'll be fine. That cyst gave me an infection. I was very ill. I was on a drip with antibiotics, and still no diagnosis. Riddle me that. Just sent home again, sent on my merry way. In the end, it took 5 gynecologists. 5, all telling me different things, that I had dysmenorrhea, which is painful periods. I don't understand what the fuck is going on with gynecology and endometriosis. I'm angry about it because of what I've been through and what I know so many others with endometriosis have also been through. So enough's enough with the medical gaslighting. Clearly, the 4 gynecologists that I saw leading up to my operation, who just told me to go away with my dysmenorrhea, were wrong. And I know for certain that I'm not the only one with this kind of experience. We will speak out about it and we will keep fighting for change, because this has got to stop.